All right, jumping right into it, huh?
Yeah.
You've brought some interesting research for us to take a look at today.
Yeah.
And I think it's definitely something that a lot of eye care professionals are going to want to pay attention to.
Absolutely.
We're talking about semaglutide,
Right.
Ozempic, Wegovy,
Yes.
and a potential connection to NAION,
Mm-hmm.
NAION, a pretty serious eye condition.
It is, and it's a hot topic right now, especially as semaglutide has become so popular.
Right, and for good reason.
Yeah, it's incredibly effective for
Yeah.
both type 2 diabetes and weight management.
Absolutely.
But as with any medication, really, I mean, especially one that is being used as widely as this one is,
Right.
it's critical to stay on top of any emerging research
Right, sure.
regarding potential risks. So
Yeah, and that's what we're doing today.
that's it.
Diving deep into a recent study published in JAMA Ophthalmology
Yes.
that suggests a possible link between semaglutide and this increased risk of NAION.
Right.
And for our listeners who may not be as familiar with NAION, it stands for non-arteritic anterior ischemic optic neuropathy.
Yeah, that's right. And, it's actually the second most common type of optic neuropathy.
Wow.
And unfortunately, a significant cause of blindness in adults.
Yeah, I mean, this is can you break that down for us a little bit more?
Sure.
What exactly is happening in the eye with NAION?
So basically, the optic nerve, which, carries visual information from the eye to the brain, isn't getting enough blood flow.
Okay.
And that's the ischemic part of the name.
Got it.
This lack of blood supply basically damages the optic nerve
Okay.
and can lead to sudden, painless vision loss. And I think what makes NAION so challenging is that as of right now, there's no really effective treatment for it.
Right. Yeah.
So vision loss is often permanent.
Wow. So this is definitely not something that you want to see in your patients.
Not at all.
So why was this study done in the first place?
Well, researchers at Mass Eye and Ear, which is a very well-respected eye hospital up in Boston, they kind of noticed they were seeing a potential uptick in NAION cases.
Okay.
And at the same time, as we were talking about, semaglutide was becoming increasingly popular.
Right.
So they decided to take a closer look
Yeah.
at their patient data to see if there might be a connection.
And this wasn't just like a, quick look.
Yeah.
They actually they dove deep.
Oh, they did a deep dive.
Yeah.
They went back and analyzed data from over 16,000 patients
No.
who were seen at their neuro-ophthalmology clinic between December 2017 and November of 2023.
Okay.
So that's a pretty substantial data set.
Yeah. So how did they go about studying this potential link?
Right. So they used a retrospective cohort study.
Okay.
So they looked back at the records of patients who had already been diagnosed with NAION and compared them to a control group of patients that didn't have NAION.
Okay. So they were specifically trying to see if the patients that developed NAION
Yeah.
were more likely to have been prescribed semaglutide.
Exactly.
Okay.
And they divided the patients into two main groups, those with type 2 diabetes
Okay.
and those that were just overweight or obese.
Got it.
And this is important because semaglutide is used for both.
Right.
And they wanted to control for any underlying differences between the groups.
So they were making sure that they were, kind of comparing apples to apples.
Yes, exactly.
So in each group, they had patients taking semaglutide
Yes,
and patients not taking semaglutide.
correct.
And then they used that fancy, propensity score matching
Yes, propensity score
to
matching.
make sure.
So that helps to create groups that are very similar in terms of other factors
Got it.
that could influence like the risk of NAION.
Okay.
So things like age, sex, other health conditions.
So they were really trying to isolate that effect.
The semaglutide. Yes.
Okay, so results time.
Right.
What did they find?
Okay, so in the type 2 diabetes group, they found that patients who were prescribed semaglutide
Okay.
had a significantly higher risk of developing NAION compared to those who weren't taking the drug.
Okay.
Over a 3-year period, the cumulative incidence of NAION was almost 9% for semaglutide users,
Wow.
compared to just under 2% for those not on the drug.
So that's significant.
It is.
What about the overweight and obese group?
Yeah, so they actually saw a similar pattern,
Okay.
and it was even more pronounced in this group.
Really?
Yeah, over that same 3-year period, the cumulative incidence of NAION was almost 7% for those taking semaglutide, compared to less than 1% for those not on the drug.
And did they look at, like, when after starting semaglutide, that risk seemed to be the highest?
Yes, they did.
Okay.
And that's one of the most interesting findings.
Okay.
The data suggests that the risk of developing NAION appears to be most elevated within the first year of starting semaglutide.
Oh, wow. Okay.
So after that initial year, the risk did seem to decrease somewhat, but it still remained higher than for those not taking the drug.
So that's definitely, something to think about.
Yeah.
This is all very compelling information.
Right.
But, with every study, we've got to be cautious about interpreting the findings of any single study.
Of course, yes.
So before we, jump to any conclusions,
Right.
let's talk about the limitations.
Yeah, absolutely.
No study is perfect.
A study is perfect.
So, what are some of the things that we need to consider when we're looking at these findings?
Yeah, I think one of the main limitations is that this study was conducted at a single academic institution.
Okay.
And so that means the patient population may not be representative of, the broader population.
Right. So we can't necessarily generalize
Right.
to everyone taking semaglutide.
Exactly. And we need to be cautious about that. And there's also the study design. Because it was a retrospective study,
Right.
it's harder to establish a cause and effect relationship.
So we can say that there's a correlation,
Yes.
but we can't say that semaglutide causes NAION
Right. Exactly.
based on this study.
Exactly.
Okay.
You got it.
So more research is needed.
Yes. So another thing is that they didn't have data on whether all the patients in the semaglutide group were actually taking the medication as prescribed.
Right. That's a good point, because we know that patient adherence can vary so widely.
It does. It really does.
So are there any other limitations?
Yeah, there's a few others.
Okay.
It's possible that there was some confounding factors, other variables that could increase the risk of NAION.
Like what?
So, for instance, smoking
Okay.
is a known risk factor for NAION.
Got it.
And if it turned out that, more of the patients in the semaglutide group were smokers,
Right.
then that could kind of muddy the waters a bit
Maybe too.
and make it harder to know the impact.
So it's possible that some of that increased risk
It's pop.
could be due to those other factors rather than the semaglutide.
It is. You never know with a retrospective study like this.
So we need to be careful about how we're interpreting these findings.
Absolutely.
But even with these limitations, I think this study raises some important questions.
Absolutely. It warrants further investigation, and I think it should prompt us to think more critically about how we approach prescribing and managing semaglutide in our patients.
Well, on that note, I think it's time for us to move into a deeper discussion about what this all means for eye care professionals
Yes.
and their patients.
Definitely.
So stay tuned, and we'll be right back to continue our deep dive.
Okay, so we've looked at the findings of this study and talked about some key limitations.
Right.
Now I think let's talk about what this all means for you
Yeah.
as eye care professionals out there on the front lines.
Wow.
What are the practical implications of this research? Is it time to panic?
Yeah, that's the big question.
Yeah, hit the panic button. Stop prescribing this altogether.
Yeah. What's your take?
Well, I think it's important to strike a balance here.
Yeah.
These findings are concerning.
For sure.
But it's important to remember that this is just one study.
Right.
It doesn't prove that semaglutide causes NAION.
Okay.
NAION.
So maybe it's more of a yellow flag than a red flag at this point.
I think that's a fair assessment.
Okay.
We need more research to confirm these findings and to fully understand the association. So I wouldn't recommend just stopping it for all your patients.
Right.
Based on this one study, I think we have to weigh the potential risks
Right.
against the very real benefits.
But
But
we don't want to overreact,
right.
but at the same time, we don't want to ignore it.
Right. Exactly.
Okay, where do we go from here?
Well, I think first and foremost, it's crucial to be aware
Yeah.
of this potential risk and stay informed about any new research that emerges, because the more we understand about this possible connection,
Right.
the better we'll be able to make informed decisions for our patients.
Yeah, so stay tuned to the deep dive.
Exactly. Keep coming back. We'll keep you guys updated as more information becomes available.
Perfect.
But beyond that, I think it's really important to educate our patients.
Yeah, that's a good point.
If a patient's considering starting semaglutide, or if they're already taking it, we need to have a very open and honest conversation with them.
Okay, so inform them.
Yes.
But don't, overtly alarm them.
Right, exactly.
How do you suggest approaching that conversation?
Well, I think it's helpful to acknowledge that there is some uncertainty.
Okay.
We can say, look, this is a new finding.
Right.
More research is needed, but we believe it's important for you to be aware of this potential risk
Yeah,
so that we can make informed decisions together about your care.
that makes sense. That's a good way to put it.
Yeah, and then taking a really detailed medical history is more crucial now than ever.
Okay.
We need to ask patients about any existing risk factors for NAION.
So like what kinds of things?
Well, like cardiovascular disease,
Okay.
diabetes, high blood pressure, family history of the condition.
So really trying to understand their susceptibility.
Exactly,
Yeah.
exactly. And then, for patients who have some of those risk factors,
Yeah.
a more conservative approach may be warranted.
So that could be more frequent eye exams.
Exactly, especially in that first year when the risk seems to be the highest.
Okay.
Or, even discussing different treatment options if they're available.
So it's all about individualizing that care?
Yes, exactly. And then, of course, we should emphasize early detection.
Right.
Patients need to know that sudden vision changes
Mhm.
should be reported immediately.
Right. Whether they're taking semaglutide or not.
Doesn't matter, call us. Time is of the essence with these things.
Couldn't agree more.
And then this also highlights the importance of research.
Right.
We need more research to figure out,
Uh-huh.
what's going on here.
Yeah, like are there any unanswered questions that you think future research should address?
Well, as we talked about, we need larger multi-center studies.
Right.
We need more robust data from diverse patient populations
Okay.
to really understand how widespread this risk might be.
Uh-huh. And do we need more clarity on like the biological mechanisms that could be driving this?
We absolutely do.
Yeah.
If we can pinpoint the mechanisms involved,
Right.
that could lead to strategies for prevention and treatment.
So understanding that why is just as important as confirming that link.
It is. And we also need to know more about long-term impact.
Right.
This study was only 3 years.
Right. What about 5 years, 10 years down the road?
Exactly. We need to know if the risk changes over time
Right.
and if there are any cumulative effects
That's
of
right.
long-term semaglutide exposure.
Yeah. So what about like different subgroups of patients?
Oh, that's another great point.
Yeah.
I mean, are there certain genetic predispositions
Right.
that could make individuals more susceptible?
So it's about taking a more personalized medicine approach?
Exactly.
Yeah.
The more we can tailor the recommendations to the patient,
Right.
the better.
I like that.
So
So there's a lot to learn,
there is.
but it seems like researchers are working on this.
Oh, absolutely. This is a rapidly evolving area of research.
Yeah.
And I'm confident we'll have a much clearer picture
Uh-huh.
of all of this in the coming years.
Well, that's good.
Yeah. But in the meantime, we have to stay informed,
Yeah.
educate our patients,
Yeah.
and advocate for continued research.
It's been great having you.
Oh, it's been my pleasure.
It's been a really insightful discussion. I think we've covered a lot of ground today.
We have.
So let's wrap things up.
All right.
Stay tuned for our final thoughts.
All right. So we've really covered a lot today.
We have, study details, limitations, and what this all means for eye care professionals.
Right.
But I want to get your perspective on one more thing.
Sure.
You talked about, what researchers need to figure out.
Mm.
But what can eye care professionals do, right now
Yeah, that's a great question.
to address this?
There are definitely some practical steps
Okay.
that eye care professionals can take today.
All right. So what are some concrete actions
Yeah.
that our listeners can implement?
Well, I think communication is always key, right?
Right.
We need to be able to explain this risk, the potential risk of NAION,
To patients who are considering or currently using semaglutide.
Right. How do we inform them without scaring them?
Yeah.
Right. Well, I think you have to acknowledge the uncertainty.
Okay.
You can say, look, this is new. We get more research, but it's important for you to know about this
Yeah.
so that we can make good decisions together.
Okay. What else?
Well, I think a detailed medical history is more important than ever.
Okay.
You really have to ask about those risk factors for NAION.
Okay. So the cardiovascular disease, the diabetes.
All of it, yeah. High blood pressure, family history.
Yeah.
And if patients have some of those risk factors,
Right.
I think a more conservative approach is probably best.
So more frequent eye exams.
Exactly, especially that first year
Yeah.
when that risk seems to be the highest.
Okay. So really individualizing that care.
Yes, 100%. And, we have to stress early detection.
Yeah.
Any sudden vision changes,
Yeah.
call us.
Doesn't
Look,
matter.
Doesn't matter.
Early detection is key.
It is. It really is.
Well, it sounds like this study has given us a lot to think about,
It has.
and hopefully our listeners feel more informed
I hope so.
and prepared to, deal with all this new information.
It's been great being here.
Yeah, thank you so much for joining us
Thank you.
on this deep dive.
It's been a pleasure.
But remember, knowledge is power.
It is.
And by staying informed, we can continue to provide the best care for our patients.
Absolutely.
Until next time, stay curious.